All right, let's jump right in. Today, we're exploring something pretty cool, healthcare innovation, specifically in the EU. You know, how digitalization and all that data exchange stuff is going to, like, totally reshape healthcare. So we're going to go deep on this recent funding call that seems to have everyone buzzing.
You mean the Innovative Health Initiative Joint Undertaking? The IHIJU.
Yeah, exactly. And our source today is this post from Haptic R&D Consulting. And they're not just analyzing it, they actually want to get involved.
Oh, wow, that's interesting.
Yeah, makes their perspective even more valuable, don't you think?
Definitely. Haptic is known for their work in fair data and AI analytics, that whole patient-centric tech thing.
Yeah.
So understanding their take on this funding call gives us some real insight into what the industry is thinking.
Okay, so for those of us who need a refresher, what exactly is the IHIJU? What's their, like, big goal with this funding call?
Well, the IHIJU is a partnership, a public-private one. They bring together all these experts and they tackle, public health challenges.
Right.
And this specific call, they're calling it Specific Objective 4. It's all about projects that use data, mHealth, eHealth, and AI to really kind of push the boundaries of what healthcare can be.
Okay, so they're not looking for tiny improvements. They want to shake things up.
Exactly. Transformative impact is what they're after, making healthcare more effective, more personalized, more accessible.
So if we're talking transformative impact, what are some things the IHIJU is hoping to see from these projects? Specific outcomes.
Okay, well, one big focus is on what they call FAIR data. That stands for findable, accessible, interoperable, and reusable.
Ah, so it's like creating a universal language for healthcare data. So everyone's on the same page, researchers, developers, everyone.
That's a great way to put it. And that kind of data sharing is super important for innovation and making sure research actually translates into real solutions for patients.
Makes sense. So FAIR data is a big one.
Mhm.
What else?
They're also really interested in projects that use mHealth and eHealth technologies to gain a deeper understanding of patients' lives and experiences. It's all about, like, empowering patients and making them the center of their own care.
So we're talking wearables that track your activity, apps that help manage chronic conditions, things like that.
Exactly. Those technologies can provide real-time data on a patient's health, allowing healthcare providers to personalize treatments and interventions more effectively.
And that's where AI comes in, right?
Big time. We're already seeing AI being used in healthcare for things like analyzing medical images, like, to speed up diagnoses and make them more accurate. But honestly, that's just the tip of the iceberg.
What about the really futuristic stuff?
Yeah.
Like, how could AI change healthcare in the years to come?
Well, just imagine AI algorithms that can, like, predict your likelihood of developing certain diseases based on your own personal risk factors.
Mhm.
Right. This kind of predictive power could revolutionize preventative care. I mean, early intervention could be the difference between managing a condition or even avoiding it completely.
That's like next level stuff. It makes so much sense, though. If you can identify risks early on, you can prevent a lot of suffering and costs later.
Exactly. And the potential goes way beyond that. AI-powered virtual assistants that can give personalized health advice, answer your questions, and even connect you with the right healthcare providers.
So AI isn't just assisting doctors. It's like a personal health advocate for each person.
You got it. And it's not just about AI on its own, it's about how AI can work with other technologies like eHealth and eHealth to create a truly, like, integrated and personalized healthcare experience.
It seems like the IHIGU is looking for projects that bring all these technologies together to make a real difference in people's lives. Not just theory, but actual tangible outcomes.
Yeah, absolutely. They want to see real impact, solutions to real public health needs. And they want a clear path to actually using these solutions in real healthcare settings.
Okay, real impact, real solutions. But what about haptic? Where does a consulting company like them fit into this?
Good question. So they might not be directly developing treatments or new technologies themselves,
Right.
but they play a huge role in bringing the right people and expertise together to make these projects happen.
So they're like the architects of collaboration, making sure these big, ambitious projects actually succeed.
Perfect analogy. Their experience with fair data, AI analytics, patient-centric technologies, and especially building those cross-sector collaborations, that makes them super valuable to any group that wants to get IHIJU funding.
They're not just consultants, they're strategic partners. They help navigate this whole complex world of healthcare innovation.
For sure. And you can see how much they understand the IHIJU's goals just from their analysis of this call. They definitely see the potential here, and they want to be a part of it.
Sounds like they're positioning themselves as the experts to go to if you want to get in on this funding opportunity.
Yeah, you could say that. They're definitely highlighting their strengths and showing they know what it takes to make these projects work.
Okay, so we've got a sense of what the IHIJU is looking for, how Haptic sees themselves in all this. But what about the specifics? What are the absolute must-haves for any project that wants to get funded?
Well, the project has to address a significant public health need. It can't just be cool tech for the sake of cool tech. It has to solve a real problem that people are facing.
Right, so a fancy new gadget isn't enough. It has to actually help people.
Yep. And it's not just about the problem, it's about how you're going to solve it. The IHIJU wants to see a strong plan for turning research into something practical, that can be actually used.
Feasibility, practicality. You need a good idea, A&D, a realistic plan to make it happen.
Exactly. And of course, focusing on the patient is super important. They want to see patients involved in the whole process of design and development to make sure the solutions actually meet their needs.
It's easy to get lost in the technology and forget about the people who'll be using it.
Right. The IHAJU is also focused on making sure projects follow EU regulations, specifically the European Health Data Space Regulation.
That's one about data privacy and security, right?
Exactly. With all this digital health data, we need strong safeguards to protect patient privacy and make sure data is used responsibly and ethically.
Makes sense. Innovation needs to be responsible.
And one more key point. They're trying to avoid duplicate efforts. They mention aligning with existing EU initiatives like, the European Virtual Human Twins Initiative and the EU AI Act. It's about creating a unified, efficient approach to healthcare innovation.
So it's not just about funding separate projects, it's about building a connected system where everything works together, right?
Exactly. It's about a strategic vision for how these projects fit into the bigger picture of European healthcare.
Okay, so we've talked about the IHIJU, what kind of projects they're looking for, what Haptic brings to the table, but how does this all connect to the bigger picture of European healthcare policy? What are the overall goals this funding call is trying to support?
Now that's where things get really interesting. This isn't just about funding cool tech projects in isolation. It's strategically tied to some of the European Union's biggest healthcare goals.
Lay it on me. How does this funding call fit into the grand scheme of things?
Well, first, you've got the European Green Deal. It's all about building a healthcare system that's more sustainable, more environmentally friendly.
Reducing waste, using resources better, being mindful of the environmental impact of healthcare, right?
Exactly. And digital technologies can play a big role in reaching those goals. Like telemedicine, that reduces the need for travel, and AI can help optimize resource allocation in hospitals.
I see, I see. So that's one big connection, sustainability through technology.
Hmm.
What else? What other big EU initiatives does this funding call link to?
Another major one is the EU Mission on Cancer. They're stepping up efforts to prevent, diagnose, and treat cancer.
I bet digital technologies are important there too.
Hugely. AI-powered tools for early detection, personalized treatments based on your genes, all that stuff. Digitalization is key to breakthroughs in cancer care.
So sustainability with the Green Deal, cancer research with the EU Mission on Cancer, anything else?
One more crucial connection is HERA, the European Health Emergency Preparedness and Response Authority. It's about getting ready for future pandemics and health crises.
Ah, I see where you're going. Digital tools to keep track of diseases, share data for quicker responses, develop new vaccines and treatments, all that. Tech can make a huge difference.
You got it. And those things are central to AgeHE's whole mission, completely intertwined with the digitalization of healthcare.
Wow. This funding call is about weaving all these threads together. Sustainability, cancer research, pandemic preparedness, and using digital tech to drive progress across the board.
Precisely. It's a holistic view of healthcare innovation, understanding how everything's connected.
This has been fascinating. We started with a funding call, and now we're talking about the future of healthcare in Europe. And I feel like we've only just scratched the surface.
Oh yeah, there's so much more to talk about.
Let's get into some specific examples of how these technologies could change people's lives in part two.
It really is amazing to think about how these technologies could, actually improve lives.
Right. We've been talking big picture, but I want to get down to the nitty-gritty. You know? How would all this actually play out for a patient? Like, walk me through someone's healthcare journey.
Okay. Imagine someone, they just got diagnosed with a chronic condition, let's say diabetes. In the past, they'd basically get some general advice about diet and exercise, maybe a prescription, and that's it.
Pretty standard, yeah. Not very personalized.
Right. But now, imagine that same person, they've got a wearable, it's tracking their blood sugar, their activity 24/7. All that data goes into an AI platform, and suddenly we can analyze patterns. We can see what's triggering those blood sugar spikes.
So instead of generic advice, they're getting insights tailored to their actual life, their actual body.
Exactly. The AI could even suggest really specific changes, like little tweaks to their diet, their exercise routine, even how much medication they need. It's like having a health coach with you all the time, but powered by your own data.
Okay, now that's cool. But what about prevention? Can we use this stuff to, stop people from getting sick in the first place?
Now that's where it gets really exciting. Think about AI risk assessment tools. They could analyze your genes, your lifestyle, even environmental factors, and flag potential health issues before you even have symptoms.
Whoa, so we're moving from reactive care to proactive health management.
You got it. Imagine you find out you're at higher risk for heart disease, but you find out early. You can change your lifestyle, get regular screenings, and potentially avoid a major health crisis down the road.
This is blowing my mind a little bit. We talked about cancer earlier. What kind of potential are we seeing there?
Oh, AI is already doing amazing things in cancer detection. Algorithms can analyze those medical images, mammograms, CT scans, all that, with incredible accuracy. They can often pick up on things, little abnormalities that a human might miss.
So we're talking faster, more accurate diagnoses.
Yeah, and that often means a better chance of treating it successfully, especially if you catch it early. AI can also personalize cancer therapies, analyzing a patient's genes, their tumor, all that to figure out the most effective treatment.
So no more one-size-fits-all chemo.
Exactly. When you tailor treatment to the individual, you up the chances of success and reduce those nasty side effects.
AI really seems like the big game changer in all of this.
It's definitely driving a lot of the innovation, no question. But we have to remember, technology is just a tool. It's about how we use it, It's about giving patients more control, helping doctors make better decisions, and making healthcare more equitable for everyone.
Right. Technology for good. So back to haptic. We've talked about all these incredible possibilities, but where do they fit in this world of AI-powered healthcare?
What's interesting about haptic is that they have this really broad approach. They're not just focused on AI or data. They get the whole digital health landscape.
They see the whole forest, not just the trees.
That's it. And that's so important for collaborations in this space. You need people who can connect the dots, between different technologies, research areas, and all the different people involved.
Healthcare innovation isn't a solo sport, right?
Absolutely. And their focus on fair data, remember that? Findable, accessible, interoperable, reusable, super important.
Yeah.
Especially in healthcare where, data is often stuck in silos and hard to share. Fair data helps drive innovation and collaboration.
So haptic is basically saying we can help you break down those data silos and get everyone working together.
Pretty much. And they've got expertise in AI analytics and patient-centric tech too, right? They know how to take that raw data and turn it into insights that actually help patients.
They've got the data expertise, the AI skills, the patient-focused approach. Anything else?
Well, one of their biggest strengths is connecting different sectors, academia, industry, healthcare providers, patient groups, all of them.
You need everyone working together if you want to see real change.
Exactly. That's where haptic's collaborative approach really shines. They're not trying to do everything themselves. They're building an ecosystem where everybody wins.
I like that. Collaboration over competition, especially when we're talking about something as important as healthcare.
Couldn't agree more. It's about working together to achieve something bigger than any one company or organization can do alone.
This has been really eye-opening. We started with a funding call, and now we're talking about reshaping the entire healthcare landscape.
It's crazy how connected it all is, right?
Before we wrap up, though, I think we need to talk about the ethical side of things. Using AI in healthcare is exciting, but it brings up some big questions.
Definitely. As we move towards this data-driven healthcare system, we have to be super careful about privacy and security.
We need to make sure we're using this technology responsibly and ethically. We can't just dive in headfirst without thinking about the risks.
Exactly. And there's also the question of access and equity, These advancements need to benefit everyone, not just the people who can afford it.
Right? It's not enough to just have cool technology. It has to be accessible and beneficial to all.
Absolutely. Technology should help bridge gaps, not make them wider.
This has given us a lot to think about. We've seen how digitalization and data exchange could really change healthcare for the better. But we also need to be aware of the challenges and make sure we're using this technology responsibly,
It's definitely complex and things are changing so fast, but it's also a really exciting time to be involved in this field.
for sure. In part three, let's step back and think about what this means for the future of healthcare. What kind of world are we moving towards? Welcome back, everyone. We've been on this awesome journey exploring healthcare innovation and how digitalization and data exchange are, set to totally revolutionize health and wellness.
It has been a pretty fascinating exploration, hasn't it? We've
Yeah.
gone from this funding call to like imagining a future where AI, M-health, all that seamless data sharing stuff, it's just a normal part of healthcare.
Totally. And we've seen how companies like Haptic are really positioning themselves to be major players in all of this,
Right.
bringing their expertise to the table, especially in data management, AI analytics, and that patient-centric approach they've got.
He seemed to really get it,
Yeah.
Not just the techie stuff, but the whole collaborative spirit and strategic vision that you need to actually change healthcare for the better.
Okay, so let's zoom out for a second and think big picture. What are the key takeaways from all this? What does this mean for the future of healthcare?
I think the biggest takeaway is that we're seeing a fundamental shift in how we think about health. Digitalization and data exchange, they're moving from the sidelines to center stage, and they have the potential to change everything about how patients experience healthcare.
It's not just about those fancy gadgets anymore. It's about using technology to solve real problems and make healthcare work better for everyone, right?
Right.
Make it more personalized, more accessible.
Exactly. We've talked about how these technologies can help patients take control of their own health, give doctors better tools, and even help us prevent problems before they start.
And it's all happening within this bigger context. It's not just individual projects here and there. It's connected to things like the European Green Deal, the EU mission on cancer, and what ADS is doing with pandemic preparedness.
Right, all those connections, they show how important healthcare innovation is to Europe's vision for the future. It's about creating a system that's not just high-tech, but also sustainable, resilient, fair for everyone.
I love how it all fits together like that. But beyond policy and technology, what does this mean for the average person? What will healthcare actually look like for individuals in this new digital world?
Well, imagine a world where everyone has access to personalized health insights based on their own data,
Right.
where we can manage chronic conditions more effectively, detect diseases early, and get treatments that are specifically designed for you.
It's like healthcare will be less about reacting to being sick and more about staying healthy in the first place.
Exactly. And it's not just about information, it's about giving people the tools and support to make smart choices about their health. It's about empowering everyone to be an active participant in their healthcare journey.
So we're talking about a future where healthcare is more personalized, more focused on prevention, more accessible, and more patient-centered. It sounds pretty amazing, but are there any, potential downsides we need to be aware of?
Of course, like with any major technological advancement, there are always going to be challenges, right? As we rely more on data in healthcare, data privacy and security, those become even more critical.
Yeah, we can't just blindly adopt new technology without thinking about the risks. Protecting patient data, making sure it's handled responsibly and ethically, that has to be a top priority.
Absolutely. And we also have to think about fairness and access. We need to make sure these advancements benefit everyone, not just a select few.
Right, so it's not enough to just have cool tech. It has to be available and beneficial to all.
Exactly. Technology should be used to bridge gaps, not widen them.
This whole conversation has been really thought-provoking. We've seen how digitalization and data exchange can revolutionize healthcare, but we've also talked about the importance of navigating the challenges that come along with it. Being responsible and making sure it benefits everyone.
It's a complex landscape, and it's changing all the time, but it's exciting to be a part of it.
Definitely. And before we go, I want to leave our listeners with a question. What excites you the most about the future of healthcare in this new digital world? What possibilities are you most looking forward to?
It's a good question, and one we should all be thinking about. The future of healthcare is being shaped right now, and it's a conversation we all need to be a part of.
Thanks for joining us on this deep dive into the world of healthcare innovation. Until next time, stay curious, stay informed, and keep those questions coming.